Okay, good evening. My name is Jeanette Rosenberg-Line. I'm a nurse practitioner student with United States University, and this is my patient, John Doe. John, do I have your permission to record our head, ear, eyes, nose, and throat exam today and upload it to YouTube?
Yes, you do.
Okay, thank you. First, I will use hand hygiene. Okay, we will start with your head exam. So I will, upon inspection, the head is round, it is normal cephalic, there are no signs of trauma, there are no lumps. Examine the scalp is clean, hair is evenly distributed, there is no sign of balding or hair loss. Okay, and then we're going to move on to the eyes. Can you look up at me? Okay, eyes are symmetric, there is no discharge. The eyelids, there is no swelling in the eyelids. Can you look up for me? And now look down. The sclera is white, conjunctiva, the sclera is clear, conjunctiva is pink. And then we're going to do a couple of vision tests. Let's start with your eye exam. So this is 6 feet away from you. And can you read the lowest line that you can read for me?
LTFPH.
Okay, so it's 20/20 with both eyes. Can you cover your left eye for me and read this lowest line?
LTFPH.
Okay, so 20/20 with the right eye and cover the right eye. And can you read that line again?
LTFPH.
Okay, and 20/20 with the left eye. Okay, then now I'm going to check for accommodation. I'm going to do first direct accommodation. Okay, and pupils are 4 millimeters, accommodating to 2. And now consensual accommodation. Good. And good. Direct and consensual accommodation are intact. And then we'll look at your optic disc. Okay, we'll dim the lights. Okay, and the device is on. So I will notice the red light reflex. And then go in. Okay, so the optic disc margin is sharp in the right eye. Okay, now I'm going to go into the left eye. Go straight ahead. And optic disc margin is sharp in the left eye. Okay. Now we're going to check your extraocular motion, cranial nerves 3, 4, and 6. So can you follow my pen with just your eyes? Okay, extraocular motion, muscles are intact, cranial nerves 3, 4, and 6. Now we're going to do your confrontation test. Can you tell me when you can see my fingers?
Now.
Okay, and again?
Now.
Okay, very good. Confrontation is intact. No, your nose. Okay. Now we're going to inspect the nose. The nose is midline. There is no septal deviations. Is there any pain here?
No.
There is no pain or pressure. I'm going to palpate the frontal sinuses. Any pain here?
No.
Any pain here?
No.
There's no pain in the frontal or maxillary sinuses. Now I will switch my devices. And we will inspect the inside of the nose. The left nair is pink. Nasal mucosa is pink. There's no swelling. There's no nasal discharge. That, and then on the right side, nasal mucosa is pink. There is no swelling. There is no nasal discharge. And then, can I have you close your eyes for me while we test your sense of smell? Cover one of your nairs and tell me what you smell.
Coffee.
Okay, good. Cover the other and tell me what you smell.
Cinnamon.
Okay, now can you take a big breath out with that nostril covered? Okay, now cover the other one again. And big breath out. Okay, sense of smell is intact and nairs are clear. Now we will move on to your ears. So upon inspection, first your ears are symmetrical. There are no lesions. There's no nodules. Is there any pain here?
No.
There's no pain on palpation. We'll start with the right ear. And get a fresh tip each time. Okay, so we're going to inspect in the right ear, the left ear. Pull the pin up and back. And the ear canal is clear. Tympanic membrane is pearly gray. Cone of light is visible at 7 o'clock. Then we will inspect the right ear. Do the same thing, pull the pin up and back. The ear canal is clear and pink. There is no discharge. Tympanic membrane is pearly gray. Cone of light is visible at 5 o'clock. Okay, now we're going to do a whisper test. Will you cover that ear for me? And then I'm going to whisper something, and I want you to tell me what I say.
7.
Okay, good. Now I'm going to go over to the other side. Cover that ear.
20.
Very good. Hearing is intact. Okay, now we're going to go to your mouth. Your lips are pink, moist. There's the lips are not chapped. There is some hair above the lip line. Will you open your mouth for me? Okay. Teeth are in good repair. Dentition is good. The gums are pink and moist. Hard palate is intact. Stick out your tongue and say ah.
Ah.
Okay, uvula rises midline upon phonation. Tonsils are visible, +1. Posterior pharynx is clear. There are no exudates. And the tongue is midline. Okay. Okay, so now we're going to inspect your neck. Your neck, okay. Your neck is symmetrical. There are no masses, no lesions, no signs of trauma. Easily palpable. Okay, and then for your range of motion, can you tilt your head all the way to the left for me? To the right, and then to the left. All the way up, like you're looking up at the ceiling, and down, and then the big circle. Okay. Subject has full range of motion in his neck. Now can you push against my hand? And push against my hand. Push against my hand. Push against my hand. Okay. And muscles are 5 out of 5. Now we're going to check your lymph nodes and your neck. So we're going to start with the preauricular, posterior auricular, occipital, submandibular, tonsillar, submental, the supraclavicular. Can you shrug up a little bit for me? And the infraclavicular, arms out, axillary, Was there any pain or tenderness?
Nope.
Okay, there's no pain or tenderness in the lymph nodes and no lymphadenopathies noted. So do your shoulder shrugs. Okay, and then against my, okay, very good. And shoulder strength is intact. Now we're gonna test your trachea. So again, the trachea is midline, and then I'm gonna go behind you to palpate the thyroid. Thyroid is palpable. It is midline. There's no enlargement, no nodules. Is there any pain when I do this?
None.
Okay, can you swallow for me? Was there any pain?
Nope.
Okay, so trachea is palpable and there is no pain when swallowing. Thank you for being my subject today.